Omeprazole is a medication that belongs to a class of drugs known as proton pump inhibitors (PPIs). Its primary role is to reduce the amount of acid produced in the stomach. Excess stomach acid can damage the lining of the stomach or esophagus, leading to painful conditions such as acid reflux, gastric ulcers, and GERD gastroesophageal reflux disease. Omeprazole is available both by prescription and over-the-counter (OTC), depending on the strength and reason for use. It comes in capsules, tablets, and even powder form for oral suspension. How does it work? To understand how omeprazole works, it's helpful to understand how acid is made in the stomach. The stomach has tiny pumps called proton pumps on the lining that produce acid to help digest food. Sometimes, these pumps work overtime, creating too much acid, which can harm the stomach lining and esophagus. Omeprazole blocks these proton pumps, stopping them from producing excess acid. Unlike antacids that neutralize acid after it's made, omeprazole prevents the acid from being produced in the first place. It takes a little time to start working, usually a few days, but its effects are long-lasting, often up to 24 hours per dose. What is omeprazole used for? Doctors commonly prescribe omeprazole for several conditions, including GERD gastroesophageal reflux disease, a condition where stomach acid flows back into the esophagus, causing burning pain and irritation. Peptic ulcers, open sores in the stomach lining or upper part of the small intestine caused by acid or infections like H. pylori. Zollinger-Ellison syndrome, a rare condition in which tumors cause the stomach to produce too much acid. Erosive esophagitis, inflammation and damage to the esophagus caused by stomach acid. Omeprazole is often part of a combination therapy to treat ulcers caused by H. pylori, usually alongside antibiotics. How to take omeprazole? Omeprazole is usually taken once a day before a meal, often in the morning. It's important to follow the dosage and duration as prescribed by a doctor. For OTC use, it's typically taken for a 14-day course, and not more than once every 4 months unless advised by a physician. Side effects and precautions. Like all medications, omeprazole may cause side effects. Common ones include headache, nausea, stomach pain, diarrhea, gas. Long-term use may lead to more serious concerns such as vitamin B12 deficiency, low magnesium levels, bone fractures especially in the hip, wrist, or spine, kidney problems or gut infections. People taking omeprazole should always inform their doctor of other medications they are using to avoid interactions. Conclusion: omeprazole has transformed the treatment of acid-related disorders. It offers relief, healing, and prevention for millions suffering from acid reflux, ulcers, and other painful stomach issues. But like all medicines, it must be used wisely and under proper medical guidance. In a world full of quick fixes, omeprazole stands out, not as a magic pill, but as a reliable helper when our digestive system needs a break. Understanding it better can help us use it more safely and more effectively.